good evening, everyone, and welcome to the fourth episode of Reach Society Ask Our Experts. And for our fourth episode, we really want to focus on an important area, which is one around health, and specifically to talk about the Reach Society's project, which is the Smart Health Project, to talk about health inequality, but also more about how can we get ourselves into a better shape health-wise. And we're well aware of the situation with COVID, but we don't want to speak about COVID, but what's done is to highlight some of the health inequalities, but underlying health issues that are clearly in our community. And I'm really grateful today that we've got our 6 experts to examine health and how to get better health within the modern Black community. We have 6 panelists, and I'll briefly say who and what they are, and then we're going to get Professor Frank Chinegwundoh to open up to talk about Reach Society Smart Health Project, the rationale for it, but health in general. So let me tell you the 6 panelists. So we've got Professor Frank Chinegwundoh, MBE. He's a consultant surgeon and Prostate Cancer UK founder. Then we have Angela Clarke, psychologist, counsellor, and RAFFA CEO. Our third expert is Dr. Keith Davidson, former Adventist education director, CAD publisher, and author. Then we've got Dr. Dwain Neil OBE. He's the Reach Society chairman, entrepreneur, and author. Our fifth expert is Paul Riddell, equality consultant and Enfield Caribbean Association deputy chairman. And our sixth expert is Dr. Melrose Stewart MBE. She's a chartered physiotherapist and an honorary lecturer at the University of Birmingham. No doubt we're going to hear the fact she's a frequent park runner. She focuses on health promotion and challenges discriminatory practice, especially in racism and ageism. So we're really going to look forward to hearing from our 6 experts on this important topic of health. So to begin with, I'd like to ask Professor Frank Chinegwundoh to describe what is meant by the Reach Society Smart Health Project, because I know he's the lead on that, the rationale for that, but health in general within our community. So Frank, I know you've got a lot to cover in a short space of time, but I wonder if you could sort of set the scene for us with regards to Black health.
Yes, thank you, Donald. Black health, is incredibly important. Health is wealth, as they say. And if your community is not healthy, then lots of disadvantages flow from that. So being healthy, both in body and in spirit and in mind, is really vital for the betterment and progression of our modern Black community in the UK. So with this in mind, the Reach Society set up what we call the Smart Health Project. And the aim of this essentially is to bring health messages to our communities. We have many experts in the health sector, and our voices are not necessarily heard in the mainstream and not especially well known to our community. Now, we felt that in order to better the health of our community, we felt that we should bring health messages into our community. So one of the ways by doing that is by publishing case studies, publishing health information on the Reach Society portals. It could be messages about hypertension, it could be messages about diabetes, it could be messages around sickle cell. And importantly, quite apart from publishing information about various health topics, was being visible at some of the Reach Society events, whether face-to-face or virtual. So for example, at the Careers Conference, we would have a Smart Health panel who would be available to talk about various topics of interest to the community. In fact, we did that this year virtually, and hopefully next year we will be physically there in person. The Reed Society, apart from the Careers Conference, which is an annual event, also puts on employability days up and down the country. And the idea would be that the Smart Health panel would be present either physically or virtually to impart health information and knowledge to our communities. So the whole idea is to raise awareness of certain health conditions and encourage our community to employ better health behaviors. So without knowledge, without information, it's difficult to make meaningful changes in one's life. So just to say that the first virtual Smart Health project event was on the 8th of April 2021 as part of the Careers Conference. And just to give you a flavour of that, we had myself as a panel chair talking about diabetes and hypertension. We had Dr. Dami Harry talking about obesity. We had Angela Clarke, who's a panelist today, talking about well-being and mental health. We also had Dr. Amanda Brown-Bennett talking about mental health. We had Dr. Sarah Kasasa talking about dental health and dental hygiene. And we had Mr. David Burton, another fellow surgeon, talking about hypertension. So each of us spoke for about 10 to 15 minutes on these various health topics. And indeed, that was recorded for future transmission. So the whole idea is to improve the health of our community through better knowledge. Thank you, Donald.
No, thank you, Frank. And what I really like is you've identified areas, that of certain health conditions that perhaps are prevalent in our community, and it's really whether or not that information is really, around in our community. You talked about diabetes, hypertension, obesity, and well-being. So I wonder if we can expand on that so that we can ask our panelists, what's the awareness like? What is it? I'm going to get each of you to answer this question. What's your awareness like of these health issues, either in your family or within the Black community? Is something like diabetes well known in our community and its level of prevalence? How about hypertension and so forth? So I'd like to get each of you to, discuss that in terms of the family and in the Black community. So Angela, I'll start with you because you were on the panel. What's your thoughts about the awareness of such issues in our community?
I feel that we can't escape the fact that the pandemic has heightened awareness about the issues of inequality among, from a health perspective, because the majority of the awareness that has been spread around the COVID pandemic is around the BAME community being vulnerable. So we can't get away from that. I suppose health has always been an issue, certainly in the Black community. It has always been an issue, but I don't think that it has been given, or it hasn't been given the attention, I suppose, that it has been now, because of the kind of negative connotations that it brings for the Black community. You are more susceptible right now. You are more vulnerable. If you are Black, in our workplaces, the risk assessment forms that we fill in show us that actually our risk factor is high. If we are Black, we have to tick forms that tell us that you are more at risk if you are from the BAME community. So So in our workplaces, we are now more acutely aware. There are webinars being put on that tell you that so everyone is talking about it, where I don't feel that was the case before.
Yeah, that's right. Because I guess when you talk about these point of view, they're not new. It's just
they're not new. No.
Yeah, and so the question is, were we as a community aware of it? Of these factors, and as you say, it's literally taken a pandemic for us to say, "Oh my gosh."
Well, I think what the pandemic has done is it's basically said that if you actually have one of these, and it's now termed as underlying conditions, whether it be diabetes, whether it be high blood pressure, whatever it is, if you have one of these, then you are more susceptible to be affected negatively if you have COVID. And so the two being connected, it makes people kind of sit up to say, well, yeah, I've actually got diabetes, or I've got high blood pressure, I've got this. So, people are more aware of what they have. People are more aware, and I'm more aware and acutely aware of people around me, because when I think about the amount of people that I personally know that have died as a result of having underlying issues and related to COVID, in my lifetime, I have never faced the amount of deaths as I have in the last 2 years. So with that fact, it forces you to, it forces you to kind of think about it differently.
Thank you. Keith, Dr. Keith Davidson, you are, really connected with, as a former Adventist education director, you're really closely connected with the Adventist church in our community. How is health issues, what's the awareness like in that regard?
Thank you, Donald. Yes, those who may be aware of the Seventh-day Adventist Church, we have a strong emphasis on health and education, apart from the business of theology and the gospel ministry. We talk about the right hand and the left hand in terms of education and health. So yes, we run many hospitals worldwide and so forth. So we have a strong bearing on health. Currently, in this country, we do not have hospitals as such, but there's a strong focus on health ministries, seminars and workshops and those things that would try to make members more aware of health issues. So we do try. I'm not saying it's perfect, but it is definitely on the table. Health is one of those issues that we constantly have as part of our program, ongoing program for our church often. So that's the sort of focus. The matter of health, mental health, which surfaced more strongly as a result of the pandemic, is something that I think we may have to pay more attention to as a church. And I think, and I hope one day I can arrange something where I can bring Angela to our congregations to talk about that aspect of health. I think we may need to do more on that. We are stronger on the other issues in terms of health, but I think we need to have more work done on that. The other thing, on a broader front, Donald, I think, of course, we as a community are not different from other communities that have health issues. For us, the ones that tend to dominate in our community would be things like diabetes is something that is strongly there. Hypertension is also very high on our screen, on our radar in terms of the Black community. And the issue of Black men and prostate cancer. So we have some issues that are definitely there, and how we address them is something that we can hopefully do better on, because if you take the issue of prostate cancer, and Frank is the expert here tonight.
Yes, we're going to get Frank to briefly talk about that and the campaigns and stuff like that. Yes,
because a lot of men are not quick off the mark to get themselves tested and so forth, and then when they realize they're too far down the line, and many are afflicted that way and pass away. I know one person who in a matter of a year and 3 months passed away because it was caught too late. So I think those are, for me, the issues. In summary, church, yes, we have an agenda, but I also see some key issues with respect to health and our community, which I hope we can address collectively and help our community to be a more abreast, and rather than reactive, be more proactive in terms of health. Thank you, Donald.
No, thank you, Keith. Dwain, the comment that Keith meant in that we need to be proactive. What's your thoughts around health awareness issues in our community?
Thanks, Donald, for the opportunity to come in at this point to talk about the issue of being proactive in our community. Most of my colleagues involved in this conversation will know that is very much my mindset, not only to health, but to all aspects of the affairs of the Black community. There is no real scope for being reactive in life, because invariably you're playing catch up. So proactivity is the key. And actually it is because of the need to be proactive why, when I became alarmed as the chairman of Reach Society about the underlying conditions that were being talked about from the start of 2020, when the COVID-19 outbreak started to take hold, I spoke to a number of people who were associated with the health sector. Frank was one of them, but there were several others. And they all said to me, oh yes, we're aware there are all these underlying conditions which disproportionately affect the Black community. And my standard response to them was, when did you try to tell our community that this was something getting out of hand and we needed to actually take control of it? And I got blank stares from people. And that was when I brought the issue to the management team. And I'm pleased that my colleagues sat round the table, said, yes, we need to be on the front foot. We need to raise the alarm. And whether COVID is resolved this year, next year, or soon after, we have got to continue to beat that drum within our community to say to folks, we need to have behaviors which are beneficial for the development of robust good health. And so for me, the issue of being very slim when you're young, you know, you're a teenager, you're young, you're gorgeous, you're healthy, but then give it 10 years, you look like a Picasso painting of yourself. If you're a man, you're 4 or 5 months pregnant. If you're a woman, you're waddling around. I'm talking about allowing ourselves to become obese. We need to be clear that that is not just not a good look, but it actually undermines our health. And I'm hoping when we hear from Mel, we'll talk a bit more about what can be done to keep ourselves from becoming obese. But I would also say on the proactivity front, many of us in the Caribbean like well-seasoned food. And unfortunately, a big component of that seasoning is salt. And once we've developed that addiction to salt, it becomes the norm. And I would say to be on the proactive foot is to recognize now you do not need to add salt of any kind to anything that you eat, because whether it's the whole meal or whether it's the fruit and veg that you consume, there is enough natural salt in all of those things to meet the requirements of the body. So for every ounce of salt that we put in our food or we consume in processed food, we are, rushing towards hypertension. And that, for me, is a big part of the explanation about why there is so much hypertension in our community. I don't believe our community as a whole understands the direct correlation. And in fact, there was only something last month on the TV where people were saying, we are now wanting to encourage industry to put less salt in processed food because we've always known for decades of this connection. I think our community should definitely abandon salt and season with herbs. Because if we do that, the hypertension is going to come under control. And of course, there are lots of other things we can do which will actually give us that better health. And that is something I would strongly encourage everyone involved with this conversation and who will view this recording to take seriously on board, because the sooner you do it, the greater your chances of having robust, good health for the long term. Thank you, Donald.
Thank you, Dwain. Oh, Dwain, I don't know. Chicken without seasoning.
Go for herbs rather than salt. That's the advice. Use herbs rather than salt. We may be ignorant about the different herbs we can use, and that's the challenge.
Yeah.
We need to up our understanding of the herbs that can make chicken just as exciting to eat.
Dwain, the jerk chicken.
Well, I wouldn't fight with anybody who must overdose on salt. We'll just say, we'll see you when your head explodes from your first throat. So you get what you seek.
Okay. Paul, what's your thoughts? As someone who's an equality consultant, you know, health must clearly be an important issue.
Yeah, thanks very much, Donald. And congratulations to Reach for establishing this great project. Amazing work you guys are doing. Yeah, I mean, in terms of the equality stuff, this kind of just reminds me, and Dwain's memory, I'm sure is better than mine, is I think when we worked at the CR, we were far more focused. The health stuff was about employment. The particular aspect that we focused on was mental health. We didn't do a lot on health inequalities. I think it goes back to what Angela was saying. I think at that particular time, not enough was known about it anyway. So the focus was much more around employment issues within the health sector. In terms of looking at it on a family basis, I think the two, and everybody's mentioned these, obviously is hypertension and diabetes. It was a large, on my mom's side, there was nine kids, and on my dad's side, there was 5. And looking back at it, I think more or less all of them suffered from one or both. In those old days when we had, Keith is gonna probably pull me up for this, but we had lots and lots of mangoes, and we had lots of stuff that we didn't realize at the time probably weren't good for us. And I suppose that was probably partly why. I myself, I'm pre-diabetic. I was, when it was diagnosed, prescribed statins, which made me feel really, really ill. And I said to my doctor, this doesn't work. I'm in pain. I need to sort this out for myself. I changed my diet. And it was through changing my diet that it actually brought it under control. And I've kept it under control for years. I just cut out, and I don't actually eat lots and lots of fatty stuff. I never did. I think it's just a family thing. So now I'm actually much, much more focused on just avoiding high fat foods really, and eating mainly low fat stuff. So I think that those are the main two. On top of that, I obviously, as Keith said, prostate is a major issue. I had problems with my prostate, and I had an operation last year in the middle of COVID in a private hospital. I've got private health insurance, which I recommend to all my family and friends. You must do it. You might think you may never did it, but that day came when they said, Mr. Riddell, we can't do the hop. I think I spoke to Frank about this. Because of COVID, all the hospitals with the Royal Free was the COVID, picked up the phone, rang my company, sorted. So I would recommend to anybody who can afford it, get health insurance, because it really, really helped mentally and physically, because it was really playing on my mind.
Yeah.
I'll tell you a story about prostate, which I haven't shared with many people. I do my PSA, and every year I tell all my friends, and you must have it done.
Yeah.
A lot of people I know take a lot of pride from not going to the doctors. It's actually quite kind of bizarre. People say, "Oh, I haven't been to the doctors," and it's almost like it's this manly thing. I don't know what it is. I go. I mean, I go to the doctors because I can't see what's going on inside. And I was talking to my brother about it, and he came up with the same thing, and I just completely lost it with him, and gave him a complete rollicking, and said, "Get this test, sort yourself out. This is ridiculous that a man of your age has never had a test."
Yeah.
My brother rings me after the test come through. He says, "Bro, you know what happened, Donald? He had prostate cancer."
Yeah.
Prostate cancer.
Because I guess in some cases, if it can be, if it's in a family. So if one person has it, the advice is that you should get checked. And particularly when I was 50,
right.
Yeah, I had an MOT, and I said, yeah, I want to get that done. So yeah, that's something. But no, Frank Paul, sorry, I cut you. I didn't know if you wanted to mention something else.
It's actually quite major, and I know that Frank's going to talk about it. I'd like him to talk about it, because when I had the problem, I came across so many Black men with the prostate. And I've got my brother-in-law is going through it now. And he says he's going through this. He has to have the treatment from Monday to Friday. And he says that when he gets there, when he gets to the hospital, most of the people on the days he goes are Black men. So it clearly is a major, major issue.
Yeah. We're going to hear from Dr. Melrose Stewart, and then we're going to get Frank to talk about, as we're on the subject of awareness, just to talk briefly about prostate. But thank you, Paul. Mel, let's hear from you in terms of health awareness issues in your family or in the community, particularly in the Midlands, that I know you study and work and live.
Okay, thank you very much. And thank you for the opportunity to talk about it. As many of you know, I'm a chartered physiotherapist and have been for over 40 odd years. And so all of my professional life has been in health. And I think because I've been in health most of my life, I've taught health, both within my family and around me. Having said that, talking health doesn't necessarily make any difference. As I've said before, a lot of my family has African Caribbean, have all the things everyone has been talking about here, the high blood pressure. We didn't have so much diabetes. I don't know why that is, but, but I think one of the biggest issues that we have is that we now have a lot of knowledgeable people in our community. We have networks. And what we need to be able to do is each person has to teach another, So I hear what Dwain was saying, that at one time, we didn't have this network. Now it's building, and we know that we can reach more people. So we each have a responsibility for that. And I've always felt a responsibility as a health professional to talk about health. People don't want to hear it, by the way, not necessarily. They don't want to... People bury their heads because health can make you anxious. What if they find something? And I'll share a story too. My niece just, recently was called back after a mammogram, and because we talk openly, she was able to share that. Now, not many families would do that openly. They're not going to do it because they're scared. And I understand that. So what we have to do is to make the conversations normal. We need to normalize conversations. I talk to my son about prostate. Clive talks about prostate. Make it okay to talk health. And I hear what you were saying about awareness of, we talk about reducing salt. Now, it's not that easy. It's not that we know what we have to do. And a bit later, I'll share some of the research that I've seen about what we know and what we can do about what we know. But I love Jamaican food. I love a lot of the things that I've been brought upon, but I also know that it has to be in moderation. You know, we can enjoy food. We can enjoy our food as we've known it, but we need to know the consequences of the content, the consequences of the volume, the consequences of long-term eating the same things. It's funny because only this week, but I couldn't tell the last time I did fried dumplings. I have not cooked fried dumplings for years. And because we had people coming over and they had Atkins saltfish, and I still have the Atkins saltfish, I boil my saltfish and I make sure the salt, a lot of the salt is not within it. But as we were talking about flavoring, we've got lots of flavors. Our pimento, Jamaica's a home of pimento, you know, adds flavor, spices to our food. And I cooked some fried dumplings, but I know that I would only have probably half of one. You know, it's lovely. It's because it's almost part of our being. You know, you can't suddenly just let go of your jerk chicken, your fried dumpling, everything, but you can do it. You can just taste it. Moderation.
Moderation, yes.
But also, you know, we're talking about general awareness. What we can say to people out there is two fundamental things. I see the other day that pharmacies are giving free blood pressure checks. Simple. Go and get your blood pressure checked. You know, that is just a walk-in service. You don't have to buy a monitor. You can get your blood pressure checked. We as a community need to tell everyone, and it's not just, I see it's for the over 40s, but we have a lot of young people with high blood pressure. We see burgeoning obesity in our young people, our school kids. We need to monitor more carefully. So if there are free tests to be had, let's help them to do that. And also in terms of monitoring sugar, I think people know about the health hazards. I think 30 years ago, 40 years ago, we could say no, but now there are so many people talking about sugar, diabetes, all these other, they do know, but they really don't know how to address their own issue. They don't know where to go sometimes, and they don't know who to turn to. And sometimes they don't really know the impact on them personally. They think it's going to be somebody else. Yeah. So people don't stop to monitor themselves. Now I could go on forever, but I'll just finish on the point about obesity, because I know, again, Dwain mentioned obesity. And I don't think we should be in here for the blame game. We have a lot of obese people in our community. For me, that is not so much the major issue. It is an issue, but in tackling physical activity, which I'm going to talk about, we can get to that because people feel almost as if it's an attack on them. They feel reticent in sharing information. I see people, when I go running, I see lots of quite large people running, and I am so proud of them. They're trying to run, but people are mocking individuals. You know, there's this snigger. So we've got to change attitudes. Let's be positive and encouraging when we see, you know, people making an effort, because that's what we've got to do. We've got to be encouraging, not, you know, pointing a finger. I'm going to stop. I can go on forever. I'll come back to some of those topics.
Yeah, no, we want to talk a bit about proactive, because I want to talk about the idea of running. And yeah. I want to talk about screening. So I want to get folks to, sure. These are questions that I want us to address. In terms of diet and the impact that Dwain and Paul and yourself, I just want to give a shout out to someone we all know is Lyndon Wissard. He's a chef, he's a writer, and he's been writing books. And I know he's spoken on one of our platforms before about the impact of diet and how, you know, many are using diet to control diabetes. And you're right, it's getting that information out there. And I spoke to him recently and he said, look, that's an area where if we can disseminate, that could be useful. So Frank, we've heard about prostate cancer and awareness. So I want you to give us a draft. You know, you are you know, involved, as you mentioned, as I mentioned at the beginning, you are the Prostate Cancer UK founder. So I wonder if you could give us your take on awareness with prostate within our community.
Sure. So before that, I mean, I'm not a Prostate Cancer UK founder. Otherwise, they'll be on my back. I do know the founder, but it wasn't myself.
Yeah.
I'm chairman of a charity called Cancer Black Care.
Yeah, that's it. Apologies.
Yes, no, that's fine. I mean, I am involved with Prostate Cancer UK, and I've been working with them for over 20 years now, and we're working together to try and raise awareness about prostate cancer.
Yeah.
Now, prostate cancer is more prevalent in the Black community. So overall, 1 in 8 men will get prostate cancer. But if you're talking about the Black men specifically, it's 1 in 4.
Yeah.
And that's Black men, whether you're in the UK or in America or in Brazil or the Caribbean or in Africa. There is something about the African diaspora that confers a 2 to 3-fold increased risk of getting prostate cancer compared to if you're white or if you're from the Asian subcontinent. What is it that gives Black men that increased risk remains unknown, despite a lot of research which is ongoing throughout the world to try and answer that question. But the fact of the matter is we are at increased risk. Now, one of the things is that if you don't know about your prostate glands and you don't know that you're in increased risks, and you don't know that there's a blood test that can help you estimate your risk, then you're not going to do anything about it. So one of the things that I've set myself to do is to reach a situation where no man, and particularly no Black man, is unaware that they have a prostate gland. They know what it does, and they know that they are at increased risk of getting prostate cancer. So the first thing is to have that knowledge. The second thing is acting on that knowledge. But you've got to start from the point of view of knowing what it is. Now, unfortunately, at school there is zero information about the prostate gland. Now, on the school curriculum, people are taught about breast cancer, and women are taught about cervical cancer, and indeed they're screening for these. But men are lagging behind in terms of that general awareness. So it's up to us, particularly as our community is affected disproportionately, to talk about prostate cancer. Now, one of the things that I always say to men who say, well, I haven't got any problems passing urine. And I say, that's good, but it doesn't mean you haven't got prostate cancer. And in fact, by the time you start having problems passing your urine, your cancer may already have spread. So the message is every Black man over the age of 45 should once a year at least get the blood test. Yeah. It's a PSA blood test, which you are entitled to on the NHS. If there's pushback from the GPs, then it's possible to send off for a home testing kit from the Graham Fulford Foundation. The message is, if you do unfortunately turn out to have prostate cancer and it's detected early enough, then the cure rate is incredibly high. It's like 99% of men are alive after 10 years. But if it's spread around the body into the bones or the lymph glands, by the time it is detected, then the outcome is not so rosy. Mm. So that's the message. All men, all Black men over the age of 45. And in terms of awareness and knowledge, one of the things that people underappreciate is that if there's someone in your family with prostate cancer, your risk is increased. So knowing your family history is important. I've come across many men who, for various reasons, don't want to tell their children that they've got prostate cancer. And I tell them, you're doing your children a disservice. You're stopping them from having the knowledge that they need to possibly save their lives in the future. The other thing to say is that if there's breast cancer or ovarian cancer in your family, maybe your mother or a sister or an aunt, you as the male have an increased risk of getting prostate cancer. So it's, one of the things that I've noticed about the Black community over many, many years is this secretiveness, this secrecy about what is wrong with you, and this lack of willingness to share. And that is doing ourselves a huge disservice. So I'd like people to share their family histories. I'd like the men to actually take some responsibility for themselves. The number of times I've seen a man come along because of some prostate problem, and it's their partners that have kind of been a push, rather than the man taking responsibility for himself and and going along to the doctors themselves.
Yeah.
Now, there are reasons why men are reluctant. There is a relationship between your prostate and your sexual health, and men are sensitive about such issues. But it's sad when I see a man who's ignored certain signs and symptoms, or just refused to have a PSA blood test, and by the time the realization dawns that actually they've left things too late, it's a very sad situation.
Yeah.
The other thing I will mention just briefly is that, and then I think it's quite an important point. There is still mistrust in the Black community about what the mainstream or the white folks are telling them. Are they people trying to stigmatize us? Are people trying to in some way make our lives lesser through health messages? And so one of the things I say to people is that there are certain things that are real. It's not just that people are trying to stigmatize us by saying we have more diabetes, or we have more high blood pressure, or we have more prostate cancer. These are real things. And I think one of the things is that if you have trusted messengers, or you have people from the Black community who are knowledgeable in these things, they're more likely to be believed and these health messages taken on board. So it's important that the message to the community comes from people who look like the community that we're trying to address.
No, thank you, Frank. And I'm going to embarrass you, Frank. And I want to embarrass you, and I want to get your response to this. So, Amen, an organization that's run by our dear friend Patrick Reed. And I blame myself because I said, Frank will speak on prostate cancer, if you recall. And I want to embarrass you, Frank, but also on a serious point as well, to get your point on this. And for the others, I just want to tell you a story. Frank gave a talk about prostate, gave a really good presentation about what it is, and provided knowledge. Look, Frank's switched up his his video. The feedback. This is where I want to get Frank's point of view and others to comment. A number of men who are either diagnosed or had prostate said, who have been diagnosed for a number of years, said, this is the first time someone has spoken to me with the proper knowledge. And some of these men, Frank, and I want you to comment on this, have been diagnosed and have been treated or undergoing treatment for a number of years. So they've been spoken to various clinical individuals, but they've still not managed to be completely aware. And I listened to Frank's talk, and I listened to the feedback, and so really I want to thank you for doing that, because you seem to be on the forefront of this idea of trusted messenger, because the people there said, I'm more knowledgeable now than ever before. And I found that alarming, because some folks said, well, I've been speaking to my GP and I still don't know what's going on. But Professor Frank, thank you for that. I'm now more knowledgeable. I'm now going to sort myself out. So Frank, I want you to talk a bit about that, and others to comment.
Yes.
About this mistrust, but in relationship to that, and it's something I had a discussion with Paul, and I want to get Angela and Mel to comment afterwards, is also something you've mentioned about breast cancer and the fact that the Black women go screening, because the evidence suggests they don't go screening as much as other communities. So I just want, again, it's about better health. So there's a lot in that, I realize, but.
Yeah. So perhaps I'll talk about the breast cancer screening and then I'll go back to the prostate.
Yeah.
It is true that Black women do not avail themselves of the breast cancer screening opportunities that they should. And there's many reasons behind that. So some years ago, I managed to persuade the Public Health England to give me money, a fair amount of money, to look into this. And the reason I did that was because I've been going to all these national cancer meetings for years, and each year the same statistics were trotted out in terms of, Black women's uptake of breast cancer screening was like 30% in London compared to 50% for other groups. And after the third year of hearing this, I said to the powers that be, well, what are you doing about it? And they said, well, we don't know what to do about it, you know. So I said, well, if you give me the money, I'll show you what to do about it. And so what I did in conjunction with another Black charity was we employed two middle-aged Black women that we called patient navigators. And then what we did was that this was in Lambeth, Suffolk and Lewisham. What we did, we got a list of 600 Black women who had been approached to go for a breast cancer screen and hadn't done so. And so what these two ladies did was to ring up, contact these ladies, which the mainstream NHS would never do, and actually ask them for the reasons why they hadn't gone. And they had a whole variety of different reasons. You know, they're going abroad, they were childcare, didn't understand about screening, so, you know, so many reasons. And what we did, we converted a third of those into actually attending for their breast cancer screening appointment. And what this showed us was that it's how you deliver the message. If you just send a letter to many people's doorsteps, they don't understand what screening is about in the first place, and therefore they ignore it. Or if for some reason they can't attend, then it's not so obvious as to how you then get back yourself into the system. So we showed that actually, if you change your approach, if you're serious about getting Black women to get screened, you have to change your approach. You have to do it on a one-to-one basis. You actually, apart from the letter landing on your doorstep, you have to actually contact them and explain the importance of it. And so we demonstrated this, and it was published on the Department of Health website and so on. And the tragedy of it was, what the Public Health England said was that this is too expensive an intervention. And so they said after the 1 year pilot, they said they were going to fund it. And so we're back in the same situation. So what galls me is that, you know, the NHS knows what to do, knows how to increase breast cancer screening, but, you know, to my mind, they're not interested. They're not interested enough.
Can I come in on the back of what Frank has said?
Yes, certainly. This is, yeah, I'd like to hear what other folks think.
That is such a powerful example of why what Reach Society has started is absolutely essential. And we would encourage other groups in the third sector to do their bit to raise awareness, because, you know, if we start from the assumption that we live in a systemically racist society, then we can't afford as a Black community to leave anything that we regard as important to other people, however well-meaning. But we do have people with the knowledge, yourself, Angela, Mel, and many, many more like you. And we are in a position to use our networks to communicate and to help people to feel comfortable in taking the right action. So I would argue we need to learn from those messages where the compassion and the interest remains low, but within our community, it has to stay high. And there are enough of us who know what's required and what the implications are of neglect to be able to spread the word. So Frank, I'm hoping your story doesn't have the sad ending, which says, well, because they say too expensive, so we're not going to do anything more, that the idea of getting greater agency in Black women around screening has died. I can give you one personal example. My wife responds to every invitation for breast screening that she's ever received. I'm not suggesting my wife is typical, but what I'm suggesting is that my wife recognizes that she would rather know than not know. And so I just think we need to use this as a clarion call. We need to continue to do what we know is necessary to get as many of our people to be proactive.
Yeah.
Can I come?
Yeah, come in, Angela. I want to hear from Angela, and then Mel, and then Frank can comment at the end towards prostate. But
yeah, I mean, I really like what you said, Frank, and I really like the initiative about making contact with people. I know that we are about to, you know, embark, certainly myself, with the faith communities are about to embark on doing risk assessments for our members. And the way that we are going to be doing that is to actually phone each individual and take them through the risk assessment process, which will be asking those questions around the types of issues that people have. If they have underlying issues, what type. What we're wanting to do is to use this as an opportunity to also give advice and information. So not just take the information, but also to give some advice. I know that I myself, I think Paul mentioned about being pre-diabetic. I was pre-diabetic myself, and I remember having that discussion with Dwain about the fact that I was, as soon as it was highlighted that I was pre-diabetic, I was contacted by the NHS with regards to attending a pre-diabetic course, they called it. And I had initial skepticism, I must say. But the other interesting thing, and I may have said this on this platform before, that when I actually did attend, I was the only Black person on the platform of probably about 30 people plus, and I was the only Black person, and I have continued to attend. It's a 16-week course, and I've continued to attend. So, you know, I do think it's important, and what I've gained, and it's really interesting because at least what I've gained over this kind of I think it's 14 weeks I've been going now, and I'm now not pre-diabetic. I'm now out of that zone, which I'm really, really pleased about. So I have actually reversed it by, you know, so I'm not anywhere near where any kind of warning or triggers really. But what I can do based on the information that I've gained by being on that course, when I'm talking to these people and doing these risk assessments, I can then pass the information on. And I think, you know, I think that, so I think talking to people, and reaching out to people is really a good way of imparting knowledge, not just taking information just because you're wanting to go back to a building, because the reality is some of the people are so scared they don't want to go back. They are quite happy to stay at home. But nevertheless, if you can actually talk to them about, you know, about everything, and when you started, I think you kind of talked about mind, body, spirit.
Yeah.
So for me, that's what's important. The health bit is around your healthy mind, your healthy body, and your healthy spirit. So being able to do that, certainly on a one-to-one, is a good way of doing it. So yeah, I just wanted to share that. And the other thing I was going to say, and it kind of talks about what Keith was mentioning, is that there is definitely a recognition that from a mental health perspective, our elders and our pastors are the people who do not get the support that they really need. They absorb things like a sponge, and they don't have any kind of outlet. So one of the things that I will be doing along with Dr. Amanda is doing a conference specifically for not just the pastors or the leaders, but their family members as well, and children, because there is a recognition that it doesn't just affect the man in the cloth, it affects the family, the whole family. So we are going to be putting on something for the family to address the holistic mind, body, and spirit. So I thought I'd just share that.
No, thank you. Mel, do you want to comment? And then I know Keith has got his
very briefly
as well.
I think it's something Frank said about there is no structure around contacting men about and informing them. These men hadn't got the message. They didn't hear the message until you had your lecture. There has to be a way. Now, I know we have structures like the church, but more people are outside the church than in the church. So we have to recognize that. So how are we going to reach people? And I also agree, sending a letter doesn't work. You know, it'll work for a few people, but people like a personal contact and also an alternative appointment. You know, there's many times when we sent an appointment, we can't make that date, but an alternative appointment would do. So we've got a lot of work to do. First, we've got a huge number of people who are outside of church structures, who we have to find mechanisms for contacting. We've got community centres, we've got to use those. And if each of us do our bits, then we can help. But there's a huge number who are not being reached. How we set up a structure to reach individuals is important, to give them the information. Frank made it very clear they're not getting the information. If the first time they're hearing about prostate cancer after 15 years, there's something very wrong there. We also have women who are going for their mammograms. I know that I go for mine routinely. I am so lucky. I'm a very healthy person. I touch wood. I keep touching wood. Mm-hmm. I only see my doctor, and it's not like men who's burying their head not going. It's because I don't need to go. I have my cervical smear. I have my mammogram test. I have my blood pressure check. I have all the checks that are going to make sure that they're okay. Now, there are a lot of people who are not doing that. Those are just simple things. How we get our individuals to do that within our families first, we ask the question. So every member of our family, we ask that question. And I asked that when I was in the university. I asked the students, do you know your blood pressure? The Black curriculum is the other thing. This is something we put on our Black curriculum within the schools. Yeah, it's something that our youngsters need to know because they have the conversations with parents and they will be the older ones. I understand that they don't check for prostate cancer below age 45. Well, we need to let our young men know. And so that is part of the conversation as well. But there's lots of information to be shared. The structures through which we share them is the difficult bit, but reach is one structure. And we know that there's lots more out there. If we can get a joined up approach and share, then we're going to be able to tackle some of the issues that we have.
Thank you. We're going to come to ask that question about how to achieve, how the community to achieve and stay robust in good health. So we're going to come on to that. But Keith, you've had your hand up, so I want to make sure your point is addressed, and then Paul.
Thank you, Donald. And I think that last point in terms of Melrose, is their contribution just now about structure. If you could come back to that, I'll leave what I have to say on that one.
Yeah.
But I think I would be in a bad place if I didn't talk about my own experience in terms of prostate. It's important that we get the message out to as many men as possible to be more proactive. It's not easy, but we should. And I've been very fortunate. I haven't spoken to Frank for a good while, but I think Dwain knows. I mean, I've spoken to Dwain as to my own situation. It started a good doctor. Having a good doctor is important. When I was 45, going near 50, I don't know if Frank may have met Franklin Jacobs.
Yes, I know Franklin.
You know Franklin Jacobs. But he was my GP. And when I was getting near 50, he was sending messages to me. He was very proactive. Sending messages to me that I should come to see him. And I was, leaving it and not responding. But my sister was also registered with him. And he told her to tell me personally I need to come to see him. So I went. And he told me the time has come for me to be having regular annual checks. And that's how my journey started. So I started to have the checks. And that went okay until he retired. And then 2010, I had a test. And it shows my PSA was just over 4. So they thought I should do some tests, the usual routine MRI scan and so forth. And did that. And that's when they told me, well, yes, there might be something there, but, we leave it for a while. And that was, I think, careless on their part, because that was 2010. Nothing happened. 2011, 12. So I took action and went to my GP. No longer Dr. Jacobs. He retired then. And I said, well, I haven't had a test since that one in 2010. So could I have a test? So I had a test. And so it had moved up from just over 4 to near 8. And so that now meant I had to do more tests and so forth, etc. And then I had the results, probably 2014 or thereabout, and more tests. So I was then diagnosed to have prostate cancer. So they started me out, they gave me some options, and I selected the one I thought may be best for me. And I have to say that it's been very good for me because of that initiative I took. Because if I did later, because I had no signs or anything, nothing going wrong, but I was just saying, well, if it happened there 2010, something, you know, I should be having more monitoring. And it was a good thing. I took that initiative. And not many men will do that. So that's where we get the message out, because as a result of that, this is now 2021, 11 years after, and I'm still here and doing okay. I'm even more busy than when I was at work, you know, a retired person. But it's essential that we get that message out, because it prevented mine escalating, and, you know, my PSA for many years now being very low. And I just thank God, really, that he has given me the insight then to take an initiative, because I know other men who have not, I mentioned one already, who didn't survive. So it's important, imperative that we get that message out. Don't wait.
No.
It doesn't cost anything, really. Just do it. And I saw Frank on television once. He actually did a test here. Of course, we didn't see everything, but it was good, because men are so reluctant and have this hang up that, you know, it's hard to understand why. But it has been a problem, because it has caused many unnecessary deaths. But I stand before you, or sit before you, I should say, tonight to say, I've been fortunate.
Well, thank you, Keith. And that leads me on to the next question. What do you do to look after your health? And we've heard a perfect example of what Keith has done. Paul, you mentioned about changing your diet, but I know you've also got your hand up. So I'll address you. You want to comment further, but I'd like to get 1 or 2 people to comment, not everybody, about what do you do to look after your health? Keith is a perfect example. You know, hold on, I did a test, but 3 years later, hold on, being proactive. So Paul, what comment would you like to make? And we'll get folks to answer that question.
The Keats, actually, because it is really tied in with what Frank kind of hit a nerve when he talked about we need a trusted messenger. And I think I may have rang you, Frank, about, I don't know, 3 or 4 times. And I want to let you know that's why I rang you, because I was in a complete state, because the quality of care that I received was terrible, if I'm being perfectly honest. Everything was changed by a Black nurse, who, before I saw the consultant, sat me down and saying, your notes are all over the place. I don't know what's going on. Come in and sit down. And my wife and I were in there for over an hour while she sorted the whole thing out. And I said to her, I need to go back in the car park. My car is in there. And she gave me a note. She goes, put this in your car and come back in this room. We're going to sort this out today. And it was due to that Black nurse that speeded up the whole process. But I was in such a state, I'm trying to cut a long story short. When I was giving my options, the trust had broken down. So that's why I rang Frank and said, look, these are my options. I know that you're not the person treating me, but confidentially, I would really respect your opinion. And I think that you can't stress how important that is. Part of it, I think, has to do that we probably don't see enough people like us. That's probably part of it. But I think we have to, I couldn't let this session go by without mentioning the quality of care that we sometimes get is atrocious. And that was my experience. It was so bad that sometimes I was getting up 12 times a night. I could hardly sleep. Some nights I hardly slept. My journeys for work, I had to plan my journey. So I'd sit down, I'd look, and I said, okay, where are the toilets? I need to know where the toilets are on my journey. No matter what journey it was, I had to. And I'm honest with people. I'm honest with my kids. In my car, I bought a bottle and I bought it with me for every car journey. It's a serious thing.
Yeah, and Paul, thank you for that. And you're open and honesty, and I think this has been amazing. Yeah. So I get a couple of people to come to this question then. So how do you look after your health? And Mel, you what have you been doing? Because you talk about running and walking.
Gosh. I'm going to go back a bit and talk about getting older and being physically active, because I think sitting time, we know, is a killer. It can be as bad for your health as anything else. So I'm getting older. I'm 67. I make no bones about my age.
Look good. Still look good.
But I recognize as you get older, physical frailty is an issue. Now, when I talk about frailty, I'm not talking about being feeble and not being able to do things. Our bounce back ability and our resilience is more challenged. Okay, so that's for all of us. As we get older, that's what's happening. And as far as I'm concerned, one of the best gifts I can give my family, while I can, and we must never hold it against other people who can't, because a lot of people have health conditions they can do nothing about, is that I keep myself well as best I can when I can. Because I've been in a caring role. I've cared for people many years. And I know that I'm in a position where I can take control of my body. I can make decisions that can keep me reasonably well. As I say, a lot of people can't, and they have to be cared for. And I understand that totally. But for me, this is why I'm doing it, because I'm going to try and stay as independent for as long as I can. My children say I'm going to be a pain to look after when I'm older, because I know I will. I'm just an independent sort of person. But the Centre for Aging Research, and I'll just share this with you because I think it's relevant to all ages really, just this last week published a piece of work that looked at people's knowledge of a physical activity. And I'm talking physical activity, partly because I'm a physio, but I know mental activity is just as important. My physical health makes me feel good. So my mental health is benefiting from it. And what they're saying is that everybody knows physical activity is important. Of all the people they spoke to, they all know physical activity is important. You talk to Black people, they say physical activity is important. What is it they're doing about it? Okay, so that's the first question. What people don't recognize so much is that your strength and your balance is also important. Not many people talked about strength and balance. So for me, and I'm talking about how I keep healthy, I have to think about strength and balance. A lot of people don't think about strength and balance as they're getting older. A lot of people don't know how much to exercise. And this is what the research was saying as well. They'll exercise, let's say they walk the dog, or they go, do a bit of gardening, but actually, is that challenging your heart? Is that making you stronger? So a lot of people don't know how much. The World Health Organization gives guidelines, but how many people are going to stop and read a book about how much exercise they should do? The other thing is, there are a lot of barriers. We have people from all socioeconomic backgrounds. And when they talk to people, the barriers, as you might guess, children, caring responsibilities, all these things. I have those. I don't have the same caring responsibilities now, but people have responsibilities. The other thing they identify is that some people, are labeled as lazy or inactive or sporty. I suppose I wouldn't label myself as, I'm certainly not sporty, I'm active, but lots of people will use those labels. And they talk about how important family and peer support was. And I would endorse that. And lastly, talking about retirement, you know what? I finished working at the university, but I don't see this phase of my life as retirement. I see it as the next phase of my life. Yeah. And so what is it I do to make sure that I stay well? And, I think tomorrow everything could change. I know that. I'm healthy today, things might change completely tomorrow. I accept that. That's how life is.
Yeah.
And having an outlook on life where you know nobody promised you a bed of roses. You know, the thorns come with the roses. So just expect that. So mental attitude, I think, you know, over the years, I've developed a strong mental attitude. But as I say, tomorrow everything could crash. I'm doing the best I can. What I've done is develop a regular habit of physical activity. And everybody, I would say, need to do that. I have it in my diary because over the last year, COVID meant that I was sitting at my computer all day if I didn't get up. I put in at lunchtime well-being, and I get up from my computer and I go for a walk or do something.
That's a good thing to do.
Right? So you put it in your diary because for me, it's priority. And I think we have to, all of us have to prioritize our health and put in where it is we're doing something about it. So that's essential to me. So develop a habit of regular activity. I've been doing physical activity and exercise, call it what you will, for over, let me see, 30 years, 40 years regularly now. I started with a friend. My friend's retired and we still keep going. So habit, just like you get up and brush your teeth. You get up in the morning, you brush your teeth. You go to your bed, you brush your teeth. That's how your physical activity should be. I make it part of what I do. Identify the amount of work you're doing. It's no good to say, yeah, I garden, I hoover, I do all those things. But so what? Is it making you stronger? Is it improving your balance? Is it making you healthier? Do things you enjoy. So
Thank
important.
you. Thank you. So I know time is you know, coming close. So I want to.
Okay, very briefly then I'll tell you what my regime looks like. I'll summarize it.
Yeah.
I walk for an hour most days. I do 10 minutes of abs, just fitness to keep my central core good. I do an hour of body attack class over the week. I do park run. Everybody can do a park run. 5 in the morning, so 5K. You can walk it, you can run it, you can go in your wheelchair, you can take your stick. Occasionally I do a 10K and I garden and I hoover and I reduce my sitting time. So that's what I do. That's what I do.
I think it's important to hear
Others.
a small amount from everybody.
No, exactly. That's what I want to hear.
What we all do to maintain good health is an important message. So why don't you ask everyone just to say what they do?
Yeah.
We may not have a lot of survey data, and Mel, that was brilliant.
Yeah.
But it just gives people a sense of what we are doing because we understand the importance.
Yeah, no, that was a question. I wanted to get other people in.
Sorry, I had the time.
I was worried about time. So as I said, you know, as I mentioned in the beginning, how do you look after your health? So we've heard from Mel, we heard a bit from Keith in terms of, you know, PSA and getting it done. So I want to hear from others. How you know, and again, because of the interest of time, we're going to keep it short. But how do you guys look after your health? And anyone.
Well, if you like, I'll dive in just to keep the momentum going. Like Mel, I'm in my mid-60s, and because I'm also retired, it's important to keep the activity going. I'm not rushing for a train in the morning and walking to a station in the evening and so on. And so I make it my business to go for a 45-minute run every single day. And when the weather is bad, I use the treadmill, which more than 10 years ago, I bought and put in my garage. So I don't have an excuse for not doing it. And for the last few years, I've got back into my teenage habit of doing 60 press-ups a day. And I have to tell you, when I started, I couldn't do more than 20. But now I'm back up to 60. And so echoing the point about strength and balance, and so my arms and my shoulders, they're no bigger than they were when I started doing the press-ups, but they definitely feel more toned, they feel stronger. But I also want to dive into the dietary part of that regular exercise, because your appetite will change if you're exercising regularly. I take a multivitamin every day, and you can get any booth shops to find a multivitamin to suit your age. And I also take a cod liver oil each day because I understand the importance of minerals and omega-3 as part of having enough of those things in your diet. And, you know, again, because I was diagnosed 2 years ago as being pre-diabetic, I have made sure I've thrown out all that red meat, and anything called processed food doesn't pass my lips anymore. And so my regular breakfast is 2 shredded wheat with a banana. And, you know, I now have vegetable milk with my shredded wheat. In other words, it's not cow's milk anymore. I've thrown all that out the window. And without fail, that has been my breakfast now for at least 2 years. Thanks to my wife, my lunch is a bowl of homemade soup. No one will be surprised to hear that it isn't overdosed with salt because she doesn't put any salt in it. And I have 3 fruit. It's an orange, it's a pear, it's a banana. That's my lunch, a bowl of homemade soup with 3 fruits. And my dinner is all whole grain and vegetable. And my wife does a wonderful stew, a meatless stew. She does some wonderful vegetarian meals, which I would recommend. You guys can't come to my house. You have
I was going to say, let's all go.
And we have a treat on the weekend. We have a bit of fish. So whether it's tuna, whether it's sea bass, whether it's cod, and that's the only homage to meat that I now eat. Prior to shifting to be a vegetable-based diet, I had meat twice a day, every day, without fail. And what that has done for me, it's helped me to drop my weight from being the real man of 14.5 stones to being half the man at 12 stones. And the good news about 12 stones is this: that was my weight when I left university at age 24. So I've gone back to my ideal weight by changing my diet and getting back into that regular exercise routine. Now, it ain't gonna work for loads of people because you know what? After 2 or 3 runs, people will drop dead, you know, because they're bored or whatever. But why it works for me is because all my young life, I was a sportsman. And then you got into the stage in your life where you dropped off on the regular activity, you pumped up, and then you get to the stage where you feel like you're carrying your dad on your back, and you know that's not the way you used to feel. And so you start doing something about it. I didn't lose the 2 stones in 2 years, it was over 5 years. And now I think I'm in the right weight category, I'm eating the right diet, and I feel good because of it. That's my regime.
Okay, thank you. We'd like to hear from others, and I know we haven't got long, so everyone keep it short so we can get folks in.
Well, like Dwain, I'm not done as much. I'm very impressed with Melrose. I feel positively ashamed having listened.
Yeah, Melrose just...
As I said earlier on, with me, I just changed my diet. It's amazing. At first, people used to sort of say, well, you're eating stuff that's tasteless. But after a while, I said to them, it actually gets quite tasty once you get used to it. I laughed at Dwain about the press-ups because I can do more than 20 quite easily. I've been doing press-ups all my life. Every morning I do press-ups and stretches. And after I had my operation in July last year, I just got used to walking. And it's very healthy. Not only did I enjoy the walk, I actually discovered for the first time where I lived because I always and that's actually, I've discovered loads and loads of parts of Enfield that I did not know exist. I wanted to just to be short on the as you know, I'm a vice chair of the ECA. One of the things that I will say, and this is linked to what Melrose was saying earlier on, we're doing some outreach work, Donald. And one of the things that we've done is that we've been in contact with a local cancer expert, and he's going to be doing some workshops with our members because we identified, you know, the lack of screening for cancer, breast cancer, as being an issue. So just as an example of the kind of things that we're doing as a community organization, to kind of spread the word amongst the community. Although we say members, obviously it's open to more than members. Anybody can come along. But we're going to start rolling that out next month.
Yeah, well, let us know, and we can more than happy publicize. Anyone else who wants to comment?
Yes, Donald, can I come in?
Yeah.
Yeah, I think it was you or Angela talked about that holistic approach to health. I think it's important. And I will just say a little bit on that. Physically, I used to do a lot of running, and then when my wife became ill, she had dementia. She passed away actually in 2019. I couldn't continue too much with that because I was now a carer and I had to do a lot. But no, I must say I'm back trying to get my physical shape back into better size, if I could use that term. So I'm registered with the gym and I go there. Last week I went 4 times, and this week less than that because I think I may have done too much last week. But so, but definitely, and it makes you feel better.
It does.
And you know, when you do that. So that's one thing. On I think mentally and that emotional side of us, we have four dimensions: spiritual, mental, intellectual, emotional, feelings, etc., and spiritual. I think I have to try to nurture those two. If I'm taking that holistic approach, so I believe in making sure that your spiritual part of you is more about your personality in a way, and how you approach things with people. That also come in mind into play too with the emotions and how we organize relationship. That's what I'm getting at, even at work or whatever it is, or in club or in any associations we are. Sometimes you have a breakdown in relationship. Well, one thing I've learned is to be a negotiator, not to allow things to put yourself last, I think, and you'll have less problems with those issues to do with emotions and so forth. Put yourself last and put people first. Be kind and generous. All those things have a bearing on your mental health. And I have a few projects myself with people I support, and sometimes I wonder, I'm not a rich person, but how do I fund all this? I say is that giving back to others, and in a way it comes back to you, and it helps you mentally and emotionally. And if you have issues with friends, forgive. All those things make us better mentally and emotionally.
Yeah.
And so that's what I want to say. Is
So
that holistic approach?
Yeah, thank you, Keith. We're going to hear from Frank and then Angela, and then I realize it's almost 8 o'clock, so no doubt we've gone over. But what you all describing is in many ways how you are, helping your own health. But this is something that the community as a whole can do. So that was going to be my question, but you've almost answered it by saying what health you're doing. So I'll hear from Frank and then Angela.
So just briefly on what I do to stay healthy. Firstly, I realized that there's a lot more that I should be doing and could be doing on that journey. Yeah, I'd like Melrose to be my personal trainer.
We would like Mel.
Anytime.
Thank you. I stopped going to the gym because I just found it rather tedious. But the thing I did enjoy in the gym was a rowing machine. So I've just invested a few weeks ago now in a Concept 2 rower, which when it arrived and I've unfolded it and set it up, is a lot bigger than it looked in the gym.
Yeah, do you have space rank?
Of some Discord in the house, but I'm assisting this space. It's not designed to be outdoors in the garden, so I have to find somewhere for it. But I enjoy, spending 15 to 20 minutes on the rowing machine, and I hope my arm strength will improve so that I can do more than 10 press-ups without collapse. I'll let you know how I get on.
Yes, well, thank you, Frank. Before Angela comes in, I've realized what I'm going to do is I'm going to get Mel to be my personal trainer, and Dwayne's wife Paula to be my chef.
Everybody needs to have a good cook in the house.
Yeah. I'm not saying my wife can't cook, but because my wife does, because she's a vegetarian. So we often have vegetarian meals, but I do still eat meat. So, but I'm cutting down. So Angela.
Yeah, for me, I suppose what the lockdown did highlight for me was how inactive I was, really, more than anything else. Rushing around beforehand, not having breakfast as the first meal of the day. I would not probably sometimes not eat until maybe 1, 2, if that. And yeah, just not doing really any exercise at all. So I suppose during the lockdown, it was more for me, even though I was active in rushing around, I wasn't actually doing any exercise. And it got worse when lockdown came because I was sitting down at a desk, and I would come into what is my office, come dining room, and I would be here maybe from 7:30 in the morning until I realized it was getting dark at night. And I hadn't really moved around that much. So when I found out after having a blood test that I was pre-diabetic, I think that's what kick-started the whole change in my whole outlook on how I self-cared. So now I do go out to walk 5 times a week, and I do it. It's become now, Mel, like the most natural thing in the world. That I get up and I get out there at 6 in the morning and I walk, and I have a buddy who lives in Kent, and the two of us, even though we're in different places, we're talking to each other and we're walking. So, and that's good because it means that it makes me do it. So, because I don't want to let her down, so I'm out there. For many years, I have a room in my house that has a bike, has a one of those machines that shake you. And also a machine that, not a machine, but something that where you do sit-ups. If only I had made use of it, because I realized that I started to develop a stomach. So right now I also, as well as walking, I do 100 sit-ups per day, 5 days a week. I eat well. My sugar intake is very limited now. I used to love chocolate. I'm not really on that now. I don't eat meat very much. I eat some fish, but I eat masses of vegetables, and I love vegetarian stuff. So I think I've totally transformed the way that I treat myself. Let me say treat myself, because I don't think I treated myself very well. I went out and I did the job and I worked really hard, but I didn't really think about me and think about my health. And I suppose having COVID as well, that was something as well that kind of kickstarted me to say, no, I've got to get through this and I've got to get stronger. So I do feel healthier. I've got a way to go because I haven't reached my ideal weight like Dwain, but I aim to do that. I'm not going to tell you what my ideal weight is.
No, it's everyone's prerogative.
But I'm going to keep going. But the other thing that I will say is that certainly what RAFFA will be doing also is that we will be assisting on the Better Health campaign that the government are launching at them, and raising awareness about obesity, obesity and what that does, and spreading the awareness about healthy living and healthy diets and things like that. So at least I've got first-hand experience because I'll be doing it, doing what I practicing what I preach in making sure that word and awareness is spread. So that's me.
Thank you.
Brilliant, Angela. That's brilliant. Well done.
Yeah, 100 sit-ups. You're all doing.
I do, yeah.
Can I just say, we mustn't beat ourselves up too much. When we start, it is hard and it's a journey. It's a journey, and starting is probably the biggest barrier. But once you've started, we're all feeling, and you're all talking about the benefits. It's amazing, the buzz and the mental health, all the things that you get out of it is what we want to pass on to others, because we're feeling it. Let others feel it too.
Even my skin, everything has improved. It's true.
Melrose point is so powerful because if you stick with it for a little while, you form the habit.
Yeah.
It only takes something like 8 to 10 weeks of doing something consistently for you to form that habit. And my confession around that is I used to have up to 2 teaspoonfuls of sugar in my coffee or tea. I now take none at all. But I can remember when I got it down to half and I said, that's it, it's done. I could feel the shakes as I was reaching for the tumbler with the sugar. And then I said, no. But 5 weeks later, the shakes had gone. And I now love the taste of coffee with a dash of milk. So it's just sticking with it and forming the habit.
And
Right.
we're not paragons of virtue. We all have things that we're still doing that we shouldn't be doing, eating. You know, it happens that sometimes you'll do well, sometimes not so well. We mustn't beat ourselves up.
No,
You
we
know,
mustn't.
very briefly, I have a Fitbit, which was a present for my children because they know that I exercise. And I only did 5K yesterday. I set a goal of trying to do 10,000 steps a day. And I looked at it today, and today I've only done 5K. But yesterday I did 15, so it's okay. I'm not going to beat myself up because I only did 5K today.
Average 10 across 2 days.
Gee, Mel, you make me. Yeah. I'm not going to say a word. But anyway, listen, we've come to the end. So I just want to get everyone to give a minute summary of where do they see. And we spoke about the beginning about Reach Society's Smart Health Project, and I'll come up with. I'll summarize, but I would like to get folks' opinion about, smart health, whether it's from Reach Society, the project we're doing, or about smart health in general. So I'd like folks to give a less than a minute summary, because I know Craig will struggle to try and get this down to an hour, but we've heard a lot today. So I just want folks to give their summary of, smart health.
Can I go first?
Yeah, certainly.
What I see as smart health, I mean, I think what we have been doing, certainly over the 4 episodes of this that we've already done, I think if we were just to get these out there far and wide, these discussions, because people need to talk about it, but people need to see that we are talking about it and hearing what we're saying. So for me, smart health is exactly what we're doing. We're talking about it, but we're not just talking about it, we're doing it, we're practicing it, we're sharing it, we're voicing our own stories. And I think if we get that far and wide, it will encourage and impact and empower and inspire. And I think that that's the Smart Health Project.
Thank you. Who would like to go next?
Donald, I'm just very, very brief.
Yeah.
I think there's a saying that says our bodies keep a record of all that we've been exposed to over our lifetime. I think that may be right.
Yeah.
And I think that for me, I think we've been saying it, as Angela said, in all the others. And I think particularly tonight, I think that it's about, for me personally, and I didn't say it earlier on, I was really ill. I had a thyroid problem. And I went from nearly 12 stones to 8.5 stones. I had to crawl down the stairs at my bottom and crawl myself up to get upstairs. I was off work for 6 months. And it really taught me that how important it is for people to take control, of their health and well-being.
Yeah. Yeah.
Yeah, I'm happy to go next.
Yeah.
My brief summary is really to say this to everyone. Know your BMI. The target range for people like us, 18 to 22. If you're outside of that range, you need to work to try and get into that. That's how you ensure that you don't become obese. It's easy to get the calculator. You just put BMI in the Google search, NHS, and it will take you to it. You just put in the numbers. It tells you what your BMI is. Don't add salt to anything you eat. Avoid processed food, because sadly manufacturers don't care how much salt they give you. And so go for more fruit, veg, raw food rather than processed food. And just get into the habit of exercising every day. As little as walking 15 minutes away from your home and walking 15 minutes back, that's your 30 minutes. You do that every day. You're doing all the right things for your heart and helping your weight to get to where it should be. That's the recipe.
Okay, I'll follow on. And because Dwain has already said what I was going to say for one of mine, if you've not already started to develop the habit of physical activity, start now. And if you need any help, I'm here. I'm happy to talk to people.
Thank you.
Get,
Can I come?
Yes,
get a family friend or a family, friend or a family person to share it with you. Exchange your goals, because if you don't share your goals, sometimes you lose them. But lastly, just try to measure the amount of work or exercise or physical activity you're doing and build on it. Yes, it's good to say that you're doing something, but build on it because you can see progress. So that's mine. Thanks.
Thank you. My take, Donald, 3 points. One, champion the business of awareness. All of us should try to champion that. The issue of being aware of our health needs, etc. Number 2, understanding that our own, we take personal responsibility. We've got to move away from just relying on the system to keep us healthy, but we take personal responsibility for our own health. And number 3, that holistic approach. I submit our 4-dimensional, spiritual, physical, emotional, and intellectual. Their needs. We are human beings. And if we're going to address health, those 4 domains, the needs should be met. Thank you.
Thank you. You stole my summary. Finally, Frank.
Sorry, Donald.
That's all right. Frank.
I just wanted to share the Reach Society strapline in terms of the Smart Health Project.
Yeah.
Better health from better knowledge because Black health matters. Thank you.
But that perfectly summed it up. Well, what can I say? So in my summary, what I've heard today, it's been immense. As always, Ask Our Experts is, I'm inspired by every one of them. And the panelists, you've all been brilliant. And to summarize, really what we've heard is the idea of the holistic approach to health and well-being, body, spirit, and mind. We've also heard about the importance, and we've all mentioned this, is about our own journey in terms of health. And key is awareness to our community. The story I heard you all have done is to take responsibility, which I think is so important. And finally, it's really making sure we've got trusted messengers. I think Frank's story about with both prostate cancer and with breast cancer demonstrates to us is that those of us that have got information can hopefully find a venue and an avenue of passing that on. And I think, the points that you've all made. So can I say to Professor Frank Chinegwundoh, MBE, Dr. Dwain Neil OBE, Angela Clarke, Paul Riddell, Dr. Melrose Stewart MBE, and Dr. Keith Davidson, thank you very much for an informative and insightful discussion.